Well, hello, everybody. This is Mark Idelman, speech language pathologist, and welcome. I'm glad you're here. Welcome to the teaching of talking, and welcome to our lessons in aphasia. And in these lessons, you're going to learn a great deal about aphasia, and you're going to learn about many of the techniques that we use with aphasia. And just remember that techniques in aphasia, every therapist will treat a patient differently. And so just understand that it's like an artist. Every artist has their own special way to go about helping people talk. So thank you for being on the call. Our subject tonight is going to be about the different kinds of aphasias, and I'm not going to really spend a lot of time on that because there are a lot of speech pathologists who go to college and go to university and they learn all about aphasia, and they learn about all the different kinds of problems and reasons and where the location is in the brain and all of those other kinds of things. But I don't want to really get into that with you. I think that probably many of you are here because you want some information, and that is, how do I talk better? Or how does a loved one who I love very much, how can I help that loved one who I love very much? I think that's what most people are interested in. And that's one of the reasons why I'm here too, is because I want to show you. I want to show you and I want to help you learn about some of the methods that you can use at home. Now, are you going to be able to walk away from these lessons and apply and do therapy and things like that? You might have some. You might learn some things that will be very, very helpful. But if you're going to really devote yourself to helping a loved one talk, then maybe you'll consider teaming up with me and letting me help you. But that's not what we're here for right now. We're here to talk about aphasia and to help you or a loved one speak better. So I just want to review maybe about 4 or 5 things very quickly. And then what I'd like to do is I'd like to invite some of you who are on the call to join me, and I'll listen to your speaking or I'll listen to your questions and I'll answer them. And I believe that you'll be much further ahead on your path of knowing what to do to help people with aphasia. So one of the first kinds of aphasias that I'd like to review, and I'm going to do just this very briefly, is called a Broca's type of aphasia. And people with Broca's aphasia, well, their speech is limited. They have some speech. They have little speech. It's limited. And it's good to see you, Raymond, and it's good to see you, Virginia. And so the people with Broca's aphasia, those are the people who have a very limited vocabulary, and they have a tendency to start speaking and then they stop speaking, and then they can get kind of flustered and forget where they are in the conversation. But it's a very disjointed speech, and people with Broca's aphasia have very, very difficult time initiating speech. That means they have difficulty coming out with what they want to say. They don't always know how to construct the language to answer a question. Sometimes it's just not there. And so they need help. And so they lose words. It's just like losing your car keys. Or forgetting where you put something down. They could be speaking and all of a sudden the word isn't there. So that's a little bit about Broca's aphasia. They have trouble pulling up words and they have trouble constructing a sentence or a phrase. Okay. So, let's see what else. Some of them, with Broca's aphasia, some of them can read. Some of them can actually read words, and some of them can actually write words. Now, I'm sure they're not able to write the Gettysburg Address or anything, but they have very limited expressive language. And when you express language, you express it in two ways. One is speaking, and one is writing. Hi, Diana. It's good to see you. Hello. And it's good to see Kellyanne. Kellyanne, it's good to see you. So that's a little bit about a Broca's aphasia. People with Broca's aphasia can usually imitate. They can imitate words. Sometimes they can imitate two words or more. So the people with Broca's aphasia, they usually have a pretty good prognosis for improvement of speaking. All right, so that's Broca's aphasia. Now, I'm going to just review another type of aphasia with you. It's called mixed aphasia. You know, there's no one aphasia. There's no Broca's aphasia or Wernicke's aphasia. You know, all of these aphasias, they all have different symptoms. And no two are alike. So just know that. No two are alike, and just because somebody says you have an apraxia, somebody else can have an apraxia too, and it could be totally different. So I don't always like to use descriptive words like, or non-descriptive words like apraxia or aphasia. I want to know what's happening when they try to talk. To me, the classification of what kind of aphasia it is really isn't all that important to me. What is important to me is what happens when we ask them a question. Do they understand? Do they understand what we're saying? That's number one. And as I've said before in these classes, number two, can they express any words? And can they imitate words? Now, I had a gentleman today who contacted me, and he said that he had a loved one, and the loved one had difficulty imitating. And if a loved one has difficulty imitating, they might have something like a Wernicke's aphasia. But again, I don't want to get bogged down with these terms. You have to be able to imitate well. Okay, you have to be able to imitate well. And if he's on the call tonight, I'm going to invite him to come on the call. And by the way, everybody, would you please make sure that you're sharing this with people you know and people you love. Tony, good to see you. And Panos, Vogue, nice to see you too. And if I butcher your name a little bit, please forgive me. And I hope you'll have your cameras on for Facebook Live, because I'd like to have a conversation with some of you. And if you have aphasia, I'd like to have a conversation with you also, so that I can share what I know with you, and I can share what I know with the others on the call. And that way we'll all learn. Okay. So it's good to see Tony, and there's somebody else here. Haitham is here, and please forgive me if I don't always pronounce a word correctly. I believe very strongly in good pronunciation, and you know, one of the things that we all know is that we all love to hear our name spoken, don't we? Yeah. We do love to hear our name spoken. And so therefore, here's a rule for everybody. That is, if you're not sure how to pronounce a name, ask. If you're not sure how to pronounce a name, ask. Always do that because people love to hear their name spoken, and they love to hear their name spoken correctly, with correct pronunciation. Okay, and thank you, Haitam. That's perfect. Well, I'm batting 1,000 so far. Well, good. So we've talked about a Broca's aphasia, which is where you can imitate words usually. You can understand pretty well usually. You might be able to write a few words. You might be able to read a few words. And those are some of the symptoms of a Broca's aphasia. And then we talked about a mixed aphasia. And a mixed aphasia, hi Barbara, good to see you. And a mixed aphasia is kind of like kind of like mixing a cake. You know, you make a cake, you put in the different ingredients. Well, with some aphasias, it's a mixture. It's a mixture of a whole lot of different things. So we're going to call that a mixed aphasia. And a mixed aphasia, people have very little speech. They try hard. Sometimes they have a difficult time understanding, and sometimes they have a difficult time reading and writing. Okay. So we've talked about Broca's, we've talked about mixed. Then very briefly, and I'm only going to spend about 10 minutes on this, and then I want to get interactive. So I hope all of you have your cameras on, and I hope all of you have your iPhones set to horizontal. And I hope you're sharing this with other people who could benefit from learning. And then you have a global aphasia. Now, a global aphasia, that's a pretty tough deal. But, you know, I've had a lot of patients say to me, Mark, my loved one has global aphasia. And then I met them, and they didn't have global aphasia. Okay? So, again, just because your loved one has been given a diagnosis of a global aphasia or an Apraxia or a Broca's or a mixed aphasia or a Wernicke's aphasia or, you know, any of these terms, okay, that's not all as important as what happens when they attempt to speak. Yeah. When I was in graduate school, we had one professor who said, I don't believe in wastebasket terms. And his definition of a wastebasket term was sometimes a diagnosis of like an apraxia or aphasia. He called it a wastebasket term because often these terms don't really describe what's going on when a person speaks or when they listen. So a global aphasia is when you have difficulty expressing and you have difficulty understanding. You have difficulty understanding, difficulty expressing. Sometimes it's like being locked away a little bit. If you can't understand what people are saying to you, and if you can't say anything, or if you have difficulty imitating, sometimes that's a global aphasia. But don't ever, and please remember this, don't ever think that if you have global aphasia, you can never learn to talk again, because I've seen people who've learned to talk again with global aphasia. I've seen people who can talk again who've had apraxia, because all of these different diagnoses have different levels of severity. They're all different. Some of them respond very well to speech therapy. Some of them, unfortunately, don't. So that's a little bit about global aphasia. Global aphasia is where you have difficulty comprehending, difficulty speaking. And when you have difficulty comprehending, sometimes you can't follow directions. You have to be able to follow directions if you're going to have speech therapy. But I've seen patients who've had strokes and who have aphasia, who just have them, who have them, maybe a week or a couple days after, they could have a global aphasia. But always remember that quite often, with time, the severity of an aphasia will decrease. And some of you out there, if you've been told that your loved one has plateaued, well, you know, we all know the story about the plateauing, but I'm not going to go into that right now. Plateauing is sometimes when a therapist doesn't know what to do with you anymore, or if your insurance runs out, or maybe the person with aphasia just isn't doing very well. Maybe it's the method, maybe it's the therapy, or maybe it's the timing of the aphasia. Because I've seen people a year after they've stopped therapy, sometimes 2 years after they've stopped therapy, and they're able to do very, very nicely with speech and language stimulation. So never, never, never formulate any concrete conclusions about whether or not you or a loved one could benefit from speech therapy. And if you do that, you'd be way ahead of the game. Because I can't tell you how many people I've seen who said, my speech therapist said, or that my loved one would never talk again. And then boom, that's it. Family says, oh, they're never going to talk again. So that's it. And, you know, I'm the type of person that if a specialist tells me something, I'd like to get 1, 2, or 3 other opinions, okay? Because nobody is God, and nobody can make, quite often, very definitive statements about what a person can do or what a person cannot do. And Kathy, Ladd, Domery, good to see you. And Andrew, it's good to see you. And I see that some of you have those little green circles on the icons, on your icons here, and I know that I'll be able to speak with you. Those of you who I don't see that your camera is on, I'm not going to be able to talk to you. And you know something? I want to be able to talk to each and every one of you. You know why? Because I can probably answer a very important question that you may have. And you know something else? Somebody else on the call may also have a considerable question that they have, and the question that you ask me might answer a question that somebody else has. So please make sure that everybody's camera is, if you're on an iPhone or like that, is in a horizontal position like mine. And I'm getting the hang of this. I'm getting better at this. And make sure, too, that your camera is on. So we're going to just continue. We've covered the Broca's aphasia. We've covered the mixed aphasia. We covered the global aphasia. Then there's the Wernicke's aphasia. And the Wernicke's aphasia is really weird because a person just has a gibberish. And I spoke to somebody just the other day also who told me that they talk up a storm, but you don't know what the heck they're saying. They're saying all these weird words, and you just can't make hide nor hair out of it. And that's what they call a Wernicke's aphasia. But remember that we don't really care all that much about whether or not it's a Wernicke's aphasia or a Broca's aphasia or a global aphasia. What we want to know is, can a person understand, can they follow a simple instruction, and can they imitate? All right? And then there are the Apraxias. The Apraxias are where you have difficulty moving your speech motor and you have difficulty saying words. And the tongue doesn't move all that well. Maybe you have trouble swallowing. So Apraxias are a considerable speaking difficulty because the motor here has difficulty. And there's therapy that'll help fix that and help improve that. Maybe not fix it completely, but will improve it greatly. Believe me. All right? So that's a little bit about apraxia and aphasia. And so I'd like to invite somebody on the call and show everybody what type of intervention or what kind of suggestion I could make. And that way you learn, and that way the other people on the call can learn too. And it's good to see Rhonda. Rhonda's here too. So everybody make sure your camera is on. Make sure that there's a setting in Facebook on the iPhone. And you have to go to the Facebook setting, and you have to be able to turn on your camera. So make sure you do that. So Rhonda, it's good to see you, and Kathy, it's good to see you. So I'm going to start inviting some folks on the call so that we can all learn. And learning's great, isn't it? Okay, so let me find somebody with a green little. Oh, here's my friend Raymond. And I saw Raymond the other day. A few moments with Raymond. And we'll talk a little bit about his speaking. And we'll spend a little time showing Raymond the next step of what to do. And so I think he'll be here soon. I'm getting a blinking of his name. And I think, oh, there he is. Hello, Raymond.
Okay.
How are you?
I'm real fine.
Good. Now, here's the thing I want you to remember. I want you to remember pause between each word.
Okay.
Will you do that?
Yes.
And what will you do?
Pause between each word.
Oh, that sounded beautiful. So Raymond was on our call last week. And Raymond, did you learn anything from that call?
Yes. I think about pause, and it's helped me tremendously.
Wonderful. You sound good, man. You know that? Has anyone told you that you are talking better?
Yes. My mother and I went to see his speech therapy today, and I think about telling me and think about sharing with you um, um, sharing with you when we visit today.
Good. Okay. Now, one of the beautiful things that Raymond is learning is that he's learning that he's going to ride his motorcycle at his own speed. He's going to talk at his own speed. Okay? It doesn't matter how fast others are speaking. You speak at a speed that you can control.
Yes. Yes.
Okay? What are you going to do?
I learn to speak loudly and control.
Right. And how about your speed?
Um, what? Which one? Which? There. What? What? What is the question? What's your question?
Okay, my question is how about the speed of your speaking? Are you speaking faster or are you speaking slower?
Slower. I think about what I'm saying.
Yes. And you're pausing between each word. And you know what the biggest thing that I've noticed?
What?
The biggest thing I've noticed, I haven't heard any ums.
Yeah.
Are you doing something differently about ums?
Yes. I I delete them.
Yes, Raymond was using a whole bunch of ums before. All right. He was using a whole lot of ums. And now he's not. You're sounding pretty good, man. You're sounding great. Okay, so this is our friend Raymond, and he's already starting to improve considerably. And I'd like to just give you a hand because your speech right now today, as compared to the way it was just last week, is very much different.
Thank you.
Okay, so bye bye, and it's been great sharing with you, Raymond.
Yeah. Bye. Bye. Bye.
Bye. Okay. So wasn't that wonderful? I don't know how many of you had the opportunity to see Raymond last week, but he's already making significant improvements. And that's why I'm sharing this with you, sharing these classes with you, to show you that speech therapy methods work. You have to make sure you find the right therapist. You have to make sure you find the right method. It's just like a mechanic on a car. There's there's some mechanics out there who are great and some of them who are not. Okay. So I'm first, Kelly, I'm going to speak with you, but first I'm going to speak with my friend Barbara Lambert. Let's see if I can find her. Let's see if I can find. Oh, here she is. So I've just invited Barbara Lambert. She's a wonderful, 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 smart, intelligent, kind woman. And Barbara gave me a lot of advice about a year or two ago, maybe about 2 years ago. I was wanted to do more with the teaching of talking, and I would call her, and she'd give me some good advice. So she's going to be on the call any second now. You know, this Facebook Live takes, I think, about 30 or 40 seconds to bring a person on the call. Make sure that your cameras are horizontal, and So I'm waiting for Barbara, and I'll wait another minute or so, or a half a minute. And, and then I think Kelly is after Barbara. So we have Barbara, and we have Kelly, I think it was. So I don't see her anymore. Let's try one more time with Barbara Lambert. I'm going to say approve. And we're going to try and get her on one more time. Now, just remember that many of you need to have good bandwidth. That means your bandwidth needs to be good. And hi, Deborah. And hi, Virginia. And so I'm going to give Deborah, or I'm going to give Barbara just about another 10 seconds. And if she doesn't come on, um, we'll try again tomorrow morning or at another time, because uh, there's some people who just don't get on, and it's just the nature of the beast. But Aaron was giving me, Arvella was giving me some suggestions about maybe going to a different kind of platform. I don't know yet. But Barbara, we'll circle back and we'll try to get you in on the call tomorrow morning. She says she can't seem to get on using my phone another time. Okay, okay. Barbara's really, really nice. I just like her so much. She's smart, and we're going to help Barbara with any challenge she may have. Okay, so let's get Kelly. So let's see how Kelly does. Now remember, you all want to have your phones in the horizontal position. You want to make sure that that you have a green icon on, that you're horizontal, and that you have your camera on. I see a lot of people here who have cameras on, and we're waiting for Kelly. Ah, look at here, Miss Kelly.
Hi.
Hello there. How are you?
Good, thank you.
And where are you calling from?
I'm from Birmingham in England.
Wow, isn't that wonderful?
Yeah.
So tell me, what is your challenge?
Um, so for me, sometimes I say boy or girl. So when I say the boy, it could be a girl or a boy. Oh,
So when you do that, and you're talking to a boy and you might say girl, or if you're talking to a girl and you say boy,
yeah.
what kind of response do you get?
Uh, confuse them,
Okay. You know,
and
there's,
I
go ahead.
feel embarrassed.
And you feel embarrassed. Well, you know, sometimes, sometimes we are the way we are. And do they know when you do that? Do they know that you have a little speaking difficulty? Do they know that or not? Sometimes.
Yeah, sometimes I I I just say the word and it get embarrassed.
Okay. All right. So let me ask you this. What do you want to have happen with your speaking? What is it that you want to achieve?
Hmm. I I want to be like I had the worst. I could say the word all the time. Now I say the wrong thing.
Okay. So is that just the word boy and girl? Would you be happy if you were just able to say boy and girl? Or are there other words?
Sometimes I say different words, a different word. It could a different work, but it doesn't matter.
Okay, let's see if I understand what you're saying. I think I understand what you're saying. So sometimes you can go to say a word and a different word comes out and it's totally different from the word you wanted to use.
Yeah. Could be. It probably